Hey, what's up, 745ers, Sky in the ceiling? How you feeling, Katie?
I'm feeling healthy.
Healthy. I'm feeling clean.
That's a good one. That's a great one. Today, guys, we're talking about something that goes with the month of November.
Yes.
I actually want to look up the phrasing of this because I don't know if it's like Men's Healthcare Month. Like, I don't know what you would call it. Like, it's
I mean, what inspired this kind of episode, especially in November, is like the trend called Movember, where
yes,
like you don't shave for all of November in like for
to raise
raising
awareness.
awareness against like, like prostate cancer or like testicular cancer, um,
Yes,
and like more like men's related
health issues.
health issues. That's right. Thank you.
Yes. Obviously, not a male. I don't have testicular cancer as an option for me. But we're gonna just talk about the stigma around men's healthcare. There is such a stigma. And then maybe because we'll talk about the falls of women's healthcare too.
Yeah.
But yeah, why speaking from experience, well, I mean, I guess you're a little different in some ways, but why might men not be so into men's healthcare?
Well, I mean, just even like kind of going down like to the basics, like if you think about just like if you think about like a man versus like a woman getting like ready even for like work or for school, really all a guy needs to do is like shower, maybe shave depending on the day, brush teeth, deodorant, put on clothes, go to work. Like I feel like women like they have to like to put like a lot more care and like detail into
Right.
like getting ready for the day. And so that kind of like, I feel like that kind of correlates to like seeking out help, like
Mm,
medically, and even, yeah, like medically, like mentally or physically. So, like the
yeah,
attention to detail is not, I guess, what
I
I'm
get that. And I think oftentimes, like, it's just for men's and women's healthcare, there are some things that are just not talked about and are more prevalent that you would want you like, for its prevalence, you would want to be talked about more. I did remember reading or watching a podcast about the not the failures of men's healthcare, but really where it's trying to do better at. And I think
Mhm.
the stigma is often if we go back to, again, the basics in the olden times, right? Like, having ailments and, like, health issues for a man, that's like that could be like you're not finding food, you're not getting dinner,
Mhm.
aka family's dead. So I think like that. Obviously, times have changed, revolutions have happened, but the same idea goes for a lot of the culture. Is that men shouldn't be quote unhealthy, shouldn't have health issues. There shouldn't be any problems with them. They should be fully strong, fully capable of all those things. And so I think that you have to recognize that everybody, woman or man, women or men, needs healthcare and needs to be checked because our bodies are just, especially in this world where like microplastics everywhere, carcinogenics everywhere. You just got to be extra aware, and you have
Yeah.
to like humble yourself almost.
No, I agree. And I kind of want to go back to like, not like maybe caveman times or like, like, or like indigenous, like when how like
Hunter
nomadic.
gatherers.
Yeah, hunter-gatherers, but, like, even, like, I don't know, like, 1900s or, like,
Hmm.
where, like, modern, like, housewife and, like, man goes to work kinda traditional
Yeah. Right.
lifestyle. Like, if you think about it kinda, like, from the man's perspective, like, if you're sick and you can't work, then you're letting down the whole family, and
Right.
and also if the person who's providing for the family can't work, that's scary for everyone else. And
Mm,
so not only is it like you're letting down everyone, but like you're also like putting them in a desperate need. So I think like I think that's probably where like the whole stigma generated from, where it's not even like, "Oh, be tough." It's, like, literally just out of necessity, like, you need
mm,
to provide,
right.
otherwise. Because I mean, also, there were so many, like, times of, like, starvation or, like, lack of resources, and so it was pretty essential for somehow, like, putting in, like, you know, the work to, like, get resources for your family. I mean, not to say, like, back then also, like, women obviously, they contributed a lot, but just, like, traditionally in the way that we kinda know it, like, that's that's kinda how the story unfolds.
Yeah, absolutely. And I think now that we come to talking about like the nowadays cancer, I think for both women and men, the often idea to put it off is the wrong idea, right? The faster
Yeah.
you catch it, the faster you can be like healed and the faster you can move on with your life. And so therefore, checking for cancer consistently when you're supposed to, and being on top of your health, it should not be seen as a weakness, but something that's gonna save you more time, and it won't cause, like, what, the failure of your family or whatever. Obviously, nowadays, things are different, but, like, that just, like, idea, like, the faster you catch it, the less awful it's gonna be.
Yeah, no, that's a great analogy. I mean, also, and it works, like, even before catching it, like, if you just, like, start early before, like, the idea of prevention, rather more like I'm not, I can't find the word, but it's like you're not preventing it, you're just like, uh
Proactive.
yeah, you're being proactive, thank you. Yeah.
Yeah,
It's just, like, on
absolutely.
your healthcare in general, and that's kinda like, even I'm trying to be proactive now with my healthcare. I run cross country, and so, like, my legs are obviously very important to me, and so I'm trying regardless of if I'm injured or not, I'm stretching, icing, heating, more stretching, lots of stretching, and a whole bunch of other.
Yeah, that's important to stretch. I mean, I pulled a butt muscle because I didn't stretch.
I worked out my legs yesterday instead of running, and my butt is so sore. It's actually insane. It
Yeah,
was such a
and
hard workout.
yeah, and I heard someone say when I was, like, planning for this podcast, I was on TikTok and, like, I guess TikTok was listening to me, but they were
Yeah,
saying, like, there are so many men in the healthcare field, specifically, like, doctors and, like, surgeons and that stuff, and you'd be surprised how many of them don't go to their own profession to seek help.
I wanna snap this one. This is mad snaps. The amount of nurses, like male nurses, I mean, I've only really seen male nurses do it. I don't know if female nurses do it or other nurses do it, but smoking, drinking,
Yeah,
terrible nutrition, like, I mean, like, I get it, like, being a nurse, I've worked
hard
in a
work.
hospital before, probably one of the hardest, scariest jobs, most intense out there, but, I mean, still, like, you gotta, like, live what you preach, you know?
Right, and you're
And
seeing
so
all these people who are doing what you're doing end up this way, and you're not still scared straight to be better?
I know, like, I feel like I would be like, "Oh my goodness, like, I need to
I'd be
get
on top
my
of my
life."
stuff.
Yeah. Who knows, though? I mean, excuse me, sorry. It's easy for us to say this because, I
Right,
mean,
we're not
you
them.
know, we're technically provided for and we have all these, like, resources and whatnot, and
Yeah, well, even, like, I think it was, like, my dad's friend, he's retired now, but he was a very successful ER trauma, like, I don't know, doctor, and he was telling me, like, he was like, "You think I'm working around the clock to save all these people? Do you think I have time to eat a nutritious meal?" He was like, "I have to just eat whatever I can find. So my health
yeah.
is dying for the sake of yours." And I was
Yeah.
like, "Wow, that's so powerful." So yeah, props to them, but I do think, even that at the minimum, get checked for things.
Yes.
Say, if you work the place in which everyone gets checked for things, you have no excuse as to not get checked for things. And you're preaching to others to get checked for things. So you must, I feel. Let's not be hypocrites.
I mean, also, though, like, on the other hand, like, self-diagnosis,
Mm,
like, I would say, like I mean, not to the on the other hand, but, like, to, like, add on to your point, like, maybe don't consult Google, like, call your physician or,
yeah.
like, actually go in to get checked out. Don't be like, "Oh, I'm" like, even don't even does self-diagnose to, like, minimize it or maximize it.
Right.
Literally get it checked out by a physician because, a cold could lead to
Numerous
pneumonia
things. Right.
or other things, so, yeah, but, like, be friends with your physician
Yeah, be
'cause
proactive.
you never be
Absolutely.
proactive, yeah.
Yeah, and I guess, like, if you wanna touch on, like, women's healthcare and, like, the failures in that, I'm listening to a podcast. You know that guy, that Diary of the CEO guy? Do you know what I'm talking about?
Y yes.
He did a roundtable discussion with all these female doctors and, like, talked about, like, women's healthcare. I'm in the middle of it, it's, like, 3 hours or something. But one thing the part that I'm on right now is talking about how no one studied researched women's anything until very recently, so, like, we just don't know a lot. And you know what? I realized, like, not even I mean, for breast cancer, I think women are more on top of their stuff to get it checked because there's just, like, more announcements about it, whereas, like, you rarely hear about testicular cancer. You're rarely, like, everyone's freaking out about it, but there's so many people with it. I mean, of course, it's more treatable for sure, but I still think, like, even women who hear about it all the time, they're not getting stuff checked as much as they should, and so it's not just a failure in the men's industry, but also the women's health industry.
Yeah.
And yeah, and we have a lot of women doctors and nurses too. So
Yeah.
quite the interesting hypocrisy.
I considered being, like, a male nurse because there's just simply aren't a lot.
Yeah.
And also, it's just like, I don't know, it's like, when's like, I get that feeling a lot where it's like something's like really difficult. And so, like, I feel like just to prove to myself I can do something difficult, like, I
Right.
want to do it. So, like, I was thinking, like, I should become a male nurse and, like, do a difficult thing. And, like,
Yeah.
yeah,
Absolutely. Yeah. But the women's healthcare thing, has its own issues within too. But it is Movember when you're seeing this. So
yes,
please spread awareness, talk about it with the males in your life, spread the
yeah,
word because we want more people to hear about it so that we can hopefully slowly and minutely change some lives, save some lives. Yeah,
yeah,
it's important to get your health checked. No better way to put it.
yeah.
Yeah.
No, I agree, and even, like, past just, like, physical health, like, to be proactive, take care of yourself, like, treat yourself with respect because actually Warren Buffett said this, and he said, like, one of the greatest pieces of advice he could give is, treat your body like you're getting one car and it's your dream car, and so, you're not getting another one, and, it's what you got, so, basically you're not gonna drive it recklessly, because if you crash it, then you're done,
No more car.
right? So, get it checked in the shop, so everything's running well, keep it nice, keep it clean, and, like, hey, it's your dream car, it's gonna be a nice car, so, like, you know, keep it maintained and treat it, like, with
Absolutely.
respect.
That's a great analogy too. Yeah. So stay
Yeah.
healthy. And also I did some research for this podcast on the way here.
Mm.
Not to scare anybody, but testicular cancer is not only for old men, okay? It's very prevalent between 15-year-olds to 22-year-olds. So not to scare anybody, but it's important to get your health checked. Talk with your physician. Zach and I are not liable for any of this information because we're not physicians by any sort, but we do think awareness is important and talking about it with professionals is also important as well.
Well, actually, I mean, what's super, like, really common among, like, teenage boys is testicular torsion, and I mean, it's kinda like when the, like, not tubes, I don't know, like, the pathways, like, within, like, your groin region kinda, like, get twisted, and so, your you have trouble, like, producing sperm, and, like, sperm has trouble, like, moving around through, like, the groin region and everything, and so, basically, yeah, that's, like, a huge, like, common thing among
Yeah.
men,
And we're
and
not
but,
trying to
like,
scare anyone.
yeah, we're not trying to scare anybody, but the thing is, like, a lot of people have it, but, like, a lot of people don't realize that a lot of people have it. Like, I remember just, like, I mean, within, like, our school, like, guys realizing that, "Oh, like, this person had the same issue, this person had the same issue, this person had the same issue." But, like, it's just so kinda, like, taboo that no one really talks about it until we, like, talk about it.
Yeah. So yeah, we're talking about it here. I mean, most people would say it's an uncomfortable conversation, but we're trying to make it more
Mm.
comfortable to spread the awareness. So
Yeah.
happy November.
Happy Movember.
Keep on
Don't
keeping
shave.
on. Yeah,
Keep on
yeah.
keeping on.
Yeah, don't you?
Do a turkey trot with a
Yeah,
beer.
like if I get oh, yeah, yeah,
Alright.
yeah.